Welcome to Madison Noteworthy Health. I'm Dr. Frank Byrne, your host, and I'm here today with Nico Skavaski, co-founder of Redox. Nico, let's get right down to it. What is Redox?
We help to connect health systems who have disparate data with other health systems as well as applications that they need to use to provide better care to patients.
So basically, you're taking data from multiple sources and getting it into the patient's health record.
Exactly. So we're producing data all the time now. We have different applications on our phone, different wearables. We're tracking data in different ways. It all needs to be used by providers to deliver better care to them. So we provide the basically plumbing necessary to get the data from either health system A to health system B, or the application within a patient's pocket to health system A. So all the plumbing necessary to move that data between those different health systems.
Well, I could say as a former practicing critical care and pulmonary physician, this sounds great. The first thing I ever did for every patient I ever had the privilege of treating, whether it was in the hospital, in the ICU, or the ER, or in my office, was to get their old records and review those old records. It's one of the great things for safety and quality of healthcare is making sure that your electronic health record, that your record is where you are when you need it to be there.
Yeah, absolutely. And the way that you probably did it was call up the old clinic, ask them to fax over the record. You get the 30-page fax and you have to thumb through it. So a lot of the companies we work with these days are actually taking that data discreetly from our API and providing tools around it, providing graphs, providing summarized views, pulling the best information to the front so the provider can really see what's most important to that office visit.
So of course we hear also a lot about privacy and security of electronic records. How do you figure that into what you're doing at Redox?
Yeah, it's of our utmost concern to make sure that the data is private, that it's safe. We don't actually store the data that we're processing. We pass it right through to make sure that it goes from one secure system to another. Of course, all the plumbing in between is secured using modern ways to do that. The same stuff that banks use, the same stuff that the governments use to keep their data secure.
That's today. What is in the future?
Yeah, we're absolutely excited about the future of Redox. Over the past 8 or 9 months or so that we've been operating, we've grown from our 3 co-founders to 9 full-time employees. We're looking at continuing to grow from the 100 applications we have developing on it right now to 500 by the end of 2016, hopefully reaching revenues where we can actually sustain ourselves as a real business. And that's an exciting concept to say. Months ago, we were an idea. We had 0 lines of code, and now we're developing something that actually adds real value in the world. I truly think that Madison is one of the best places in the country to start a health tech company. Obviously, we have Epic here, which means that walking the streets, we have people with knowledge about healthcare that far surpasses most sort of lay people in the country. If you're starting a health tech company in Madison, there are a ton of resources, a ton of companies who have done this before. Definitely reach out to me. I talk to 5, 6 healthcare companies every single day with what we do, and I'd be happy to share advice, connect you with other people who have gone the path that you're setting out to do.
Well, I also want to thank you because you've been a key catalyst. You and your co-founders have been a key catalyst because you were co-founders of 100 State. And there's other co-working spaces and incubators and business generators going on around here as well now too, but you've been right at the center of this, so thank you for that.
My pleasure.
That's the story on Redox. I'm Dr. Frank Byrne. Thank you for joining us on Madison Noteworthy Health.